Hi, how are you, Doc?
Hello, I'm fine.
Are you ready for our session today?
Yes, I am.
Okay.
Come on in.
Thank you, thank you. Alright, Doc. So today we would like to get your point of view with regards to COVID-19 vaccination for pregnant women and those who are undergoing IVF treatment.
Okay.
So you ready for this?
Yes, I am.
Okay. So first and foremost, Doc, it's been a while, like this pandemic actually. From your point of view, should pregnant women be vaccinated?
Yes, I strongly recommend that pregnant women should be vaccinated, especially either before they get pregnant or during the mid part of their pregnancy, between 14 to 33 weeks of their pregnancy.
Right, okay. Why is it important for pregnant women to be vaccinated, Doc?
Well, studies have shown that women who are pregnant have got a higher risk of getting severe forms of COVID-19 compared to non-pregnant women. And when they do get COVID-19 infection, it can cause more higher incidence of admission to ICU as well as intubation, and can even cause death. And not only that, it can also affect their babies. There are higher incidence of premature deliveries and high blood pressure during pregnancy, and even babies born dead, we call it stillbirths.
Oh my, okay. All right. Okay, now that we got that out of the way, right? It does take a while for them to confirm whether or not vaccine is suitable for pregnant women.
Yes.
Okay. When is the right time for pregnant women to get their jabs actually?
Basically, they should get their jabs before they embark on a pregnancy, or even if they are pregnant, they should take it around the 14th week till the 33rd week of their pregnancy. The first jab should be taken between 14 to 33 weeks of their pregnancy, and then the second jab, depending on which type of vaccine they get. Commonly, the one that we recommend during pregnancy is the Pfizer vaccine, so that should be taken about 3 to 4 weeks after the first jab.
Yeah. Right, I see.
But in case a woman has got a high risk of getting COVID infection, then of course, even in the first 3 months of the pregnancy also they can take it, or even when they are embarking on the pregnancy also, immediately also they can take the vaccination.
I see. So basically any time also.
Anytime, yes.
But the sooner the better.
The sooner the better, yes. The early part of the pregnancy better, because the incidence of COVID-19 is more seen during the last 3 months of their pregnancy, the late part of their pregnancy.
I see. All right. Okay. Now, Doc, there's actually some talk circulating around passive immunization, like the mother who get themselves vaccinated would actually have the baby to have passive immunization. Now,
you are right.
What do you think about that?
Passive immunization means the mother gets vaccinated and the vaccine goes through the placenta into the baby, and the baby gets immunization as well towards the vaccine. But this is seen more in the influenza vaccine as well as the pertussis vaccine that we commonly give during pregnancy. They have not found such passive immunization in the babies in COVID vaccinations. However, having said that, we find that there are antibodies present in the breast milk of pregnant, lactating mothers, and therefore these babies do possibly benefit from the antibodies that may protect them against the COVID infection. But more studies are needed to evaluate whether the babies get actually any immunization during pregnancy, and whether they also get any or protection against COVID from mothers who have been vaccinated during the pregnancy.
Right, I see. Okay. Now, doctor, when it comes to the COVID-19 vaccines itself, there's so many kinds of it. Is there any preference to it?
Basically, the one that is recommended is the Pfizer vaccine, because it is an mRNA vaccine. The other vaccine, which is also mRNA vaccine, is the Moderna vaccine. But having said that, even the Sinovac vaccine also can be given, and even the AstraZeneca vaccine also is safe for pregnancy. But there are still studies that are needed to evaluate, larger studies needed to see whether these vaccines are safe. But so far, the benefits of these vaccines outweigh the risks. Currently, the Ministry of Health Malaysia recommends the Pfizer vaccine during pregnancy.
Right, okay. Let's talk about those who are trying to conceive. Okay, now what do you think, Doc? Should they avoid from taking the vaccines?
No, we strongly recommend that anyone who is embarking on fertility treatment should embark on the vaccination program, because there are infertility treatment is going to result in a pregnancy, and obviously we want to protect them against the COVID infection during pregnancy. The vaccine has been proven to not increase any incidence of infertility or adverse outcomes during fertility treatment. So therefore, we recommend women who are undergoing infertility treatment to undergo the vaccination program.
Right, I see. Okay, and so basically, those who are trying to conceive and those who are already undergoing IVF treatment, they both can take the vaccine.
Both, we recommend taking the vaccination.
Right.
Yes.
Okay. Now, doctor, there are some concerns on COVID-19 vaccine being associated with blood clot actually, and how they say this is very concerning for even to those for non-pregnant women.
Yes, the AstraZeneca vaccine has been implicated to cause a blood clotting disorder known as VITT, or vaccine-induced thrombotic thrombocytopenia, but that is very rare. The incidence is 7 per million, and it has not been proven to increase the risk in pregnant mothers nor in women who are taking contraceptive pills. So we strongly would recommend taking the vaccine anyway, because the benefits outweigh the risks, and the risk of this complication is very rare.
Right, I see. Okay, now that's quite a relief actually.
Right.
All right. So overall, doc, just wrapping up, after all that we've discussed, we can conclude the safety of the vaccines in both pregnant women and those who are undergoing fertility treatment.
Basically, we recommend that the vaccination be given because, number one, the vaccine has been proven to be safe during pregnancy, in the pre-pregnancy and during pregnancy, and also after they give birth. It is safe for breastfeeding mothers. The benefits far outweigh the risks, and most importantly, the risks are quite severe in the sense that it can cause risk to the mother and to the baby. Like I said earlier, to the mother, there is an increased risk of the mother having admission to ICU and death, and having high blood pressure during pregnancy. The risk to the baby include premature deliveries and stillbirths. So obviously we would recommend that pregnant mothers be given the vaccination either before or during the pregnancy, or even after they deliver their babies during the breastfeeding time.
Right. All right, doc. Okay, that's all the time that we have today. Thank you so much for your time.
No problem.
And I wish you well. Just stay safe, doc.
Thank you.
All right. Thank you.
Thank you very
Have
much.
a nice day.
Thank you.